Salam and welcome everyone to another episode of The Real Diagnosis. Today's episode is going to focus on health policy in America. It's been a trying time in the United States, and so we wanted to take a second to look back at everything that's happened. I am happy to introduce our guest for this show today. His name is Dr. Abdul El-Sayed. He's a physician, an epidemiologist, an activist, an educator, an author, a speaker, a podcast host, and a community leader. I want to thank and welcome to the show, Dr. Abdul El-Sayed. Thank you so much for coming on.
I'm honored to be with you, Dr. Ahmed. Look forward to the conversation.
So let's just jump right in. You're somebody who's been a public health official in a major city in America. The last 6 to 7 months have been incredibly trying, especially with the pandemic. As somebody who is acutely aware of how the health system needs to respond to a pandemic like this, where did we come up short as a nation?
You know, frankly, it's hard. It's hard to actually find where we came up right as a nation. The best way to think about a pandemic is like a wildfire. They always start with one spark, and similarly, if you can put out the fire when it's small, you don't have to deal with the wildfire. And if you can put out the first couple of cases, and you can identify people who are sick, you can get them into quarantine, stop them from spreading the disease. Then you can stop a pandemic. But we failed to do that largely because the institutions in our country that are supposed to do that were dismantled or underfunded, frankly, over the past several decades, and most acutely under this administration. And then as this pandemic got big, we needed to have testing capacity right away. We needed to be able to contact trace at scale. And we didn't have those things as the novel coronavirus made landfall in the United States. And then as we started to take drastic measures, which were fundamentally necessary, things like shutting down schools and locking down communities, this got extremely political very quickly. And that politicization has now led to the reduction in following very basic safety protocols like social distancing or wearing masks. And rather than recognize where the flaw was and fix it, the leadership at the very top of our federal government, the president, has continued to politicize this pandemic. Even now, as we think about the potential advent of a vaccine, he continues to politicize that vaccine, which of course could reduce the overall effectiveness of a vaccine, because a vaccine is a very different thing than a vaccination.
Right.
For a vaccine to be effective, it has to go into someone's arm, and that has everything to do with trusting the vaccine. And if you think that that vaccine that you're considering taking is a function more of a politically driven process than a scientifically driven one, you may not take it. And in order for this vaccine to be effective at bringing down transmission, we know that about 70 to 90% of people have to take it. And right now, if you just look at public polling, a large plurality of folks think that this process is being driven by politics. Nearly 50% of people say that they wouldn't take a vaccine if it were available today, and that does not bode well for turning vaccines into vaccinations. And so it's not just that the politicization on the part of the president has failed us in the past; it's failing us actively in the future.
Right. So you mentioned that the institutions were essentially being dismantled, and this has been going on for the last couple of decades. And they're being underfunded and essentially handicapped. And if they were in place, they were dissolved. Why is this sort of preparation, when every single scientist that has spoken about issues like new viruses that are emerging on the scene says this is a real concern, this is something that all nations need to be worried about, this is the next big threat? Why in our country is this not a priority? How does this get swept under the rug?
A friend of mine who I really respect, a guy named Brian Castrucci, who runs the De Beaumont Foundation, shared this concept, and I think it really is right, that in America we have toxic individualism. And that leads to a constant focus on whittling down government. And usually the people who are whittling it down don't understand how it works. And the thing about public health is that you want it to be there in the moment when you need it, but you really never know when you're going to need it. And so if your main goal is to whittle down government because you believe that government is part of the problem rather than part of the solution, and you go to a public health department and say, why is your budget this big? And they say, well, we're preventing really bad things from happening. That same politician will say, well, bad things aren't happening. And they'll say, yes, because we're stopping them. And they'll say, well, I don't I don't see that you stopping them, so I'm going to go ahead and cut your budget. And that happens over and over and over. And the extreme example is, in fact, in the city where I used to work in Detroit, when in 2012 the city had gone through foreclosure, bankruptcy and takeover of its finances by the state, and they made a decision to zero out the city's public health budget, literally defunded public health in the city of Detroit. And that is a real problem when you think about preparedness. So Detroit now, which was hit extremely hard in March, April, and May, was handling or trying to handle this pandemic with a health department that was functionally 5 years old. And that is part and parcel of the challenge here.
And so you're somebody who essentially you're a runner-up in the Democratic primary for governor of the state of Michigan. And one of the platforms you ran on was Medicare for all. And that seemed to resonate with so many people. As a physician myself, I thought that this pandemic was really going to highlight the fact that we don't have healthcare coverage for all of our citizens. How do you think if we were under a one-payer system, a Medicare for all type of model, how would that have, how do you think our outcomes could have been different? Would they have been better?
I think there's three ways they would have been better. First, we know that a lot of people just don't have health care in America. And if you're talking about a pandemic, you really, really want people to be able to get health care when they need it, because if they're not coming to medical attention, it's plausible that they could be unknowingly spreading a disease. Number two, one of the biggest issues that we're still struggling with is that we don't have basic PPE, personal protective equipment for frontline healthcare workers. And the reason why is because in our country, healthcare runs for profit, both on the part of insurers and the part of hospitals. And the problem there is that, when you run for profit, you're really focused on a bottom line, which means any additional overhead that you don't see the immediate need for, you should cut. And so, hospitals are run just in time, meaning they have just enough PPE, to last the next several weeks. That's a real problem when the next several weeks are in the middle of a pandemic. And that's exactly what happened.
Yeah.
And then third, we were watching, especially in March through May, as a number of hospitals were facing bankruptcy at the same time that they were facing COVID. And the reason why is because, they run on very thin margins, and those margins are usually made up for by the most lucrative elective cases, elective surgeries. And when those were stopped to make room for patients coming in with COVID-19, those hospitals were then in a position where they were facing bankruptcy even while they were trying to battle a pandemic. All of those things would not have happened in a Medicare for all world, because you have one payer, which is the federal government, and that federal government then can stock and invest in the kind of resources that those hospitals need. It can infuse them with the monetary resources to stay open in the middle of a crisis like a pandemic, and everyone's covered.
And so I want to kind of lead that into the current system, the model that we have, and some of the classic stories that we heard in terms of the pandemic. One of the early on arguments or political debates that were being held were whether or not we should lock down the entire nation, if we had enough ventilators. There was a coronavirus task force. And it seemed like there were so many different players on the scene who were saying different things. And for us, as people who are kind of trying to figure out what's the next step, what is going on with this virus, what should we do? How does something like that emerge? Is it just because of a lack of leadership? How did it become so politicized?
It's not just the lack of leadership. It is leadership that cares more about its political standing than the well-being of the people that it's supposed to serve. I mean, I'll be frank with you. Donald Trump has been a train wreck of a president, and in one of the most important ways has been his handling of this pandemic and healthcare overall. He's been talking about a healthcare plan that is only 2 weeks away, and that was like 4 months ago. And yet he wants to repeal the ACA, which in fact could really happen sooner than we even expected with the passing of the late great Justice Ruth Bader Ginsburg. Because the Supreme Court is set to hear a case about the constitutionality of the ACA on November 10th, which is a week after the election. And if Trump succeeds in filling his seat with an ideologue, it's highly likely that the ACA will be deemed unconstitutional, meaning that about 20 million people would lose their health care in the middle of a pandemic. The hard part about this is that you expect the President of the United States and senators and congresspeople in the United States to care most about people in the United States. I mean, that's the whole point of our Constitution is to protect and defend the people. And the problem is that they have put partisanship and they have put ideology ahead of the people, and this pandemic has shown that for what it is. And who suffers? Well, 200,000 people who've died, millions more who've suffered and lost livelihoods, and the millions more who struggle, secondarily because they're related to people who either died or got sick or lost a job or lost a home, or you name it. And so, it didn't have to be that way. It should not have been that way. I always say that a virus is an act of God. A pandemic is man-made, and we didn't have to be here.
Yeah, it's certainly surprising that our country is accounting for a fifth of the worldwide deaths of COVID. So that's something that's hard to grapple with. Do you see any success stories? I mean, because it seems like each sort of situation in the United States when it comes to pandemic response has now become state specific. This state did this. Florida didn't have a lockdown. Illinois had a lockdown. Have you seen any success stories? And to follow that up, how can we, in the cases where states are really struggling, how can people promote like important health values, like wearing a mask or trying to maintain social distancing?
Yeah. Look, my state has actually done a very good job on this, and that's because we've had leadership that's willing to stand in the cut and make the hard decisions. Our lockdown started earlier and lasted longer, and therefore, when a lot of states were struggling into the summer, June, July, August, our state wasn't. And that really matters. And, I ran against the current governor, but I have to give credit where credit is due. The issue with mask wearing and ordinances is that you got to remember that although it sounds the same, there are perpetrators of misinformation and there are victims of misinformation. And you got to remember who you're talking to. When you're talking about the perpetrators of misinformation, you got to meet them with the facts, and you've got to be aggressive with those facts. Those people are misinforming people because they have money to make on the back end of it, right? When you tell people, listen, a mask is a violation of your civil liberties, but by the way, you should buy my product on my website because it will protect you from COVID-19 if you're not wearing a mask. They're trying to make money off of you. Those people are perpetrators. But then a lot of the people who choose not to wear masks, they're often victims of misinformation. And I think when you talk to people who are victims of misinformation, you have to ask, why were you so susceptible to misinformation? And oftentimes it's out of fear. And I think yelling at people who are afraid is never useful. I think we've got to bring our best, most empathic foot forward and ask, why are you fearful, and what can we do for you to make you less fearful, and where do we meet you where you are? Because that's what's going to address that fundamental kernel that leaves people so susceptible to this misinformation.
And on that note, we'll take a quick commercial break. We'll be back with Dr. El-Sayed. We'll talk a little more about the upcoming election and some other thoughts from him as well.
Billboards are popping up all over the country with an...
Our neighbors don't realize that Muslims are absolutely opposed to ISIS.
Salam. My name is Abdul Mujahid. I'm an imam in Chicago.
16 shots! No me!
No justice!
No me!
So how do we bring up the energy which can really have an impact on the world? You need to build bridges of understanding among people, and we need to have America moving forward. That lesson learned brought the strength of humanity to America, which is the diversity.
Mujahid Talks, only on Muslim Network TV. Faithfully connected.
And we're back. This is The Real Diagnosis. We have our special guest, Dr. Abdul El-Sayed. I wanted to jump right back into the conversation. We have around 7 minutes left, 8 minutes left. I wanted to talk about the upcoming election. It's obviously, we were talking about the pandemic and how this has changed everything. And so how we are used to elections with different sorts of campaigns is really different, at least for the Biden campaign as opposed to the Trump campaign. But what do you think are some of the central issues that the swing voters are going to be focused on this election? That seems to have been what determined the outcome of the last election. Everybody seems to have voted for Trump in this really important swing states. What are people going to be focusing on, you think?
Well, I think one that's rocketing to the top is the future of Obamacare. You look at beyond sort of severe ideologues, most people like the fact that they don't have to worry about being sick to get health insurance, that they'll be covered even if they have pre-existing conditions. Most people appreciate the fact that Medicaid has expanded, and now that there's a threat that that'll all go away in the middle of a pandemic. So that I think is number one. Number two, there has been a conversation about Black Lives Matter and protests following the murders of George Floyd and Breonna Taylor and the shooting of Mr. Blake in Kenosha, Wisconsin. And the peaceful protests that we saw after those moments have been demagogued by Donald Trump. He has tried to put a spotlight on a few incidents of violent behavior that is never okay, and he's tried to characterize the entire Black Lives movement as just a bunch of rioters and looters. And there's some evidence that he is speaking to a particular tone in our history, right? This sort of silent majority that Richard Nixon spoke to fearmonger among largely white suburban voters about some threats coming from urban communities and black people. And it is the worst in our politics, but Donald Trump is the worst in our politics. And then a third issue that I think will matter is jobs following the pandemic and the pandemic itself. I think this is probably underlying all of the other issues, and I think this is probably the most salient issue in the lives of most Americans. That whether it's your life is not what it used to be, or you've lost a job, or you've lost a loved one, COVID-19 is the issue for you. And so, as much as Donald Trump is trying to dissuade voters from paying attention to it, or use other issues to distract voters, this is the existential issue of our time. And so, I think the Supreme Court fight, COVID-19, and the way one characterizes the uprisings following the police brutality incidents that we saw over the summer, I think these are going to be the real fault lines in the election.
Yeah, it seems there's been a deliberate attempt by the Trump campaign to make him look like a law and order candidate, just like Nixon did. And so there's definitely a base, like, as you mentioned, that he's appealing to. I want to bring up the Democratic Party because there are not a lot of people who were excited about Biden being the nominee. There were some concerns there. You're somebody who was a candidate, and a lot of kind of the credibility you earned was being from the community and working within the community. And that's why you got the endorsements of like Bernie Sanders and AOC. How can this party not break and fall apart? It seems like there's been so many divisive politics within the Democratic Party for the identity of the party. What do we need to see to have a successful election come November?
Well, I think most importantly, everyone's got to come out and vote. Look, we've got to beat Donald Trump. I campaigned my heart out for Bernie Sanders, and now I'm campaigning my heart out for Joe Biden. And the reason why is because we've got to beat Donald Trump. I think about the people that I got to serve when I was health director in the city of Detroit. I think about all of the folks in communities across the country. I think about our own Muslim community, and I ask, under whom will these people be better off? And there is no question to me that these folks are better off under a Biden presidency than they are under a Trump presidency. Look, I think that no candidate is ever perfect, and there are a lot of things that I disagree with the vice president on, and I've made those things very clear. But at the same time, I believe in democracy. I believe that we should expand people's health care, not take it away. I believe that we should expand access to the American dream rather than put kids in cages because their parents dared to bring them here believing in it. I believe that we need to take on climate change rather than stop enforcing basic climate policies that Donald Trump and his acolytes have chosen not to enforce since the beginning of the pandemic. I mean, these are basic things, and so we have a responsibility to come out and and defeat this person, and then have a conversation about who we are, who we want to be, what the party is going to be. And I'll tell you this, the progressive base is not going away. We are the future of our party, and I think most people know that. And the reality of it is that change doesn't happen immediately. It takes time, and we have a responsibility to walk forward and finesse that change, and to do so, believing in the future that we can build. And I think that that right now that means defeating Donald Trump and saving our democracy from someone who is straight up using the tools of fascism and apologizing for white supremacists. And then it means continuing to work forward for solutions to our healthcare issues like Medicare for all, for solutions to climate change like the Green New Deal, for solutions to the exorbitant cost of higher education by making college free and eliminating debt. I mean, these are things that we will continue to work for. We cannot stop working for. But right now, democracy itself is on the line. We have a responsibility to support and vote for Joe Biden to stop it.
And do you anticipate if Joe Biden wins the election in November, do you expect his administration to reflect that progressive base that exists within the Democratic Party?
Look, I think it'll be a lot more diverse than we have seen in almost any other administration. In large part because I think Joe Biden and his team understand that the party of the future will look different. And so, how do you create a coalition of people? One of the things that I got to participate in was the Unity Task Force on Healthcare. I was one of 3 Bernie Sanders appointees among 8 total. 5 others were Joe Biden appointees. And we were able to come together and work together to build a platform, that it wasn't what any of us started with. And, is something that I think really could move our country forward in some real ways. It doesn't go far enough, in my opinion. I believe in Medicare for all, but I do believe that if we were able to snap our fingers and get Joe Biden's health care plan done, so many more Americans would have health insurance. So many more would be secure in knowing that they could afford their prescription drugs, and that is meaningful. And so, even sometimes, if we want to run, we may be frustrated walking a little bit, or walking fast. But I would take walking fast over being dragged backwards anytime.
Yeah. We have a couple of minutes left. I want to hit some other topics and get your thoughts on it. Chuck Schumer and Elizabeth Warren recently came out talking about student debt. That's one of the things we talked about. It's obviously a major concern for so many voters. What do you think about their recent call to cancel $50,000 of debt as an executive order? Your thoughts on that?
I think it's great. I'd like to see them cancel all of it, but I think it is great, and I think it is a move forward. Too many Americans right now would love to get on with their lives, to buy a house and start a family, except for they feel like they have a chain around their neck that is debts associated with doing the thing we tell every young person to do, which is go to college, right? You shouldn't have to be leashed by that debt just to do that thing. And so I think this is a move in the right direction.
Last minute, I want to just ask, what are your thoughts for people who are at home right now? They're just worried about what to do, how to move forward. Who are some of the trusted sources that they can turn to? How can they filter all of the various agendas that are out there?
Look, I think what I always tell folks is that, number one, the news is not fake. You're always better hearing a number of different issues, so don't just get your news from one source. Make sure you're getting it from a number of different sources. And then, I think it's really critical to take an honest eye, right? Like there is sort of a new level of literacy that we need to have when we're engaging the internet, and just bring some skepticism to what we hear and what we see online. Don't just read the headline and then be moved by it. Click in the article and see what that headline is based off of. And then, I tell everybody, make sure that you're registered to vote. Today is National Voter Registration Day. You can go to vote.org. You can go to votesaveamerica.org/register. But make sure you're registered. Make sure that your loved ones are registered. Make sure your friends are registered. Post something online about registering. It's critical that we lift our voices and we build the America we want for our kids and grandkids.
Well, we'll leave it at that. I really appreciate you coming on the show and talking to us. I also want to put in a plug for your book, Healing Politics. I just got finished reading it. I thought it was amazing, and it was incredible just to hear about your own personal journey. So really want to thank you so much for coming on.
Thank you. Thank you for having me.
Of course, our pleasure. And tune in next week for another diagnosis or another episode of The Real Diagnosis.